Hey guys, Dr. Celestine here. I want to talk to you a little bit about ectopic pregnancy. So the word ectopic just means that the pregnancy is located not in the uterus. It's located in another part of your abdomen. The most common location for that is the fallopian tube, but it can be in other spots. Now, an ectopic pregnancy is not a normal pregnancy. It's actually a medical emergency, as a pregnancy should not be existing anywhere else outside of the uterine cavity. But it's really rare. Only about 2% of pregnancies are ectopic pregnancies. Some of the symptoms can be a little confusing because it's similar to early pregnancy where you would have pain and vaginal bleeding. Someone who's at risk for an ectopic pregnancy, first and foremost, if you've had one before, you are at a high risk of having one again. And also, if you've had surgery before leading to scar tissue in the abdomen or inside the fallopian tubes, that can put you at an increased risk of an ectopic pregnancy in the future. Or if you've had something called PID or pelvic inflammatory disease that can happen from gonorrhea, chlamydia, or other pelvic infections as well. So what's important is, especially if you have a risk of the ectopic pregnancy and if you're pregnant again, make sure you see your doctor as early as possible and get blood work, ultrasound to make sure that the pregnancy is developing in the right space. And in general, if you're pregnant, you should be seeing a doctor early on in the pregnancy, and this is one of the reasons why. So at around the 6 to 8 week mark, making sure that the pregnancy is in the proper location and not an ectopic is one of the things that we do at the very first prenatal visit.